Try to give the historical perspective
Okay.
as to when and why
Smoking is
the law was
the substance in smoke that has been found
as well as
most addictive is nicotine.
we should recall in Nigeria
Is
nicotine
drug
that
addiction.
during the
drug addiction or drug abuse
And analog
indiscriminate use of drugs.
sometimes even designed
Sickle cell disease.
Yes, there is a link between malaria and sickle
Eat
cell
well,
disease.
drink treated
Because,
water, and the spread of cholera will go
Just
to
okay, let me even start this way to make it more clear. Just
If you want to be theoretical, it applies to even men. Well, in practice,
the chief servant.
This is MediShow.
Sickle cell disease is the most prevalent genital disease, and based on World Health Organization indices, Nigeria accounts for 75% of infant sickle cell cases in Africa, and almost 80% of infant death from this disease. For every infant born with this ailment in Nigeria, 3/4 of these infants will die. So how can this genital disease be contained or stopped? This is MediShow. Today on MediShow, we have Dr. Ahmed Abdulsalam from the Department of Medicine, IBB Specialist Mina. You're welcome to MediShow.
Thank you very much.
According to World Health Organization statistics, 85% of infants are actually dying from the disease of sickle cell. What is sickle cell?
Sickle cell disease, in a more liberal way, sickle cell disease. Okay, let me just start by making a distinction between sickle cell disease and sickle cell anemia, because most of the time people use them interchangeably,
Okay.
and they don't really mean the same thing.
Okay.
So sickle cell disease is actually a broader term, which sickle cell anemia is one of them.
Okay.
So, and sickle cell anemia, since it's the topic of our discussion today, I think I'm going to concentrate more on that.
Okay.
Sickle cell anemia, it's a kind of inherited disease. The word inherited there now means it's being gotten from the parent.
Okay.
And this disease now, it's a disorder of the red cells, that's blood. And it leads to the red cells assuming a rigid shape, that is a rigid sickle shape. The normal red blood cell, it's a biconcave disc, that's the normal shape of the red cell. But in case of sickle cell disease, instead of the red cells to assume the normal biconcave shape, the shape changes to in the form of sickle. That is where he got the name from.
Sickle.
Yes,
Okay.
and you could also describe it as a crescent shape, just like the moon.
Okay.
Yes, that's another way you could describe the sickle cell. And the sickle cell anemia, before an individual will be diagnosed as having a sickle cell anemia, it's when the both parents have the abnormal gene, then that's when an individual stands the risk
Of having it.
having a sickle cell disease.
Okay. Are there any link between malaria and sickle cell disease?
Yes, there is a link between malaria and sickle cell disease, because most sicklers, okay, let me even start this way to make it more clearer. Just there is a where statistics actually existed, like in the United States of America, for instance, the prevalence of sickle cell disease is actually more commoner in Black Americans. That is, Americans that are of Black origin or ancestors. It's actually commoner in them. And when you trace the history backward, they are of, let's say, African origin or sub-Saharan origin where malaria seems to be endemic.
Okay.
You understand? Then again, sickle cell anemic patients, they kind of have suppressed immunity, and this alone could expose them to more malaria attack. And malaria, again, on its own part, tends to expose them to more crisis. So you can see the relationship between malaria and sickle cell is like a two-way thing.
Because every time they'll be having malaria frequently.
Yes, and that's why in their treatment, or rather in the follow-up cases, we normally give them what we call paludril. It's actually anti-malaria prophylaxis and also folic acid in the treatment.
What genes are related with sickle cell disease?
Just as I said earlier, sickle cell disease, it's autosomal recessive disorder. I know you are smiling. What that actually means is that the chances, or rather, it's been inherited in a recessive form. Both parents have to have the abnormal gene.
And what is this abnormal gene?
Yes, the problem actually in sickle cell, there's a point mutation. You understand? That's what we call it.
Okay.
There's a point mutation in position 6 of the beta chain of the hemoglobin. I'm sure this might sound strange. What it means, like in a normal red blood cell, there is what they call hemoglobin. It's inside the red cell. The hemoglobin is responsible for carrying oxygen around the body. So the hemoglobin now has two chains, the alpha chain and the beta chain. So in this beta chain, there's what we call arrangement codons of some amino acids. So there are a lot of positions, 1, 2, 3, and so on. At the position 6 of this beta chain now, there's what we call mutation. There's supposed to be the initial amino acid sequence there. There's a substitution of valine. It's glutamate that's supposed to be there, but it's been substituted with valine. And as a result of that, the whole gene, that's the reading of that gene now, is abnormal. So instead of now forming the normal biconcave disc cells, the cells that have been formed takes a sickle shape. So that's where the problem is.
Okay. Most of our infants are dying because of this disease. What would you say is the cause of sickle cell?
Okay. Just as I mentioned earlier, sickle cell disease is actually an inherited disease that you inherited from the parent. You understand? But to be on a lighter note, sickle cell disease, it's when the both parent, I'm referring to the mother and the father now, have a trait of the disease, or rather one of the parent is affected, is a sickler, and the other one is a carrier.
Okay.
Yes. So that is basically, it's inherited kind of disease. You understand? Then as I mentioned earlier, okay, it's good for me to also say something at this junction. The sickle cell disease anemia, it's when the both parent, when the patient now, or rather the subject, inherit the two genes, the two abnormal genes from both parents. So that's when you will see us saying SS.
Okay. So you're taking S from your mother, and then you take
taking
S
another
from your
S
father,
from your
making
father.
it SS.
SS.
Okay.
So that's the sickle cell anemia we're talking about. Then there are other variants too, like we call them sickle cell trait. That's when you inherited one normal from one parent and one abnormal from the other parent. So you also hear us saying this patient is AS. So that AS patient is not actually a sickler, but is a carrier.
Is a carrier.
Is a carrier.
Okay.
Yes.
What are the signs and symptoms of sickle cell disease?
Sickle cell disease, generally, it has a lot of symptoms. And usually, symptoms are not usually evident in the first 6 months of life. It's usually, it's begin to appear that in the second half of the first year.
Okay.
Yes, and this is, you can actually explain this medically in the sense that there's what we call hemoglobin, as I said before, hemoglobin. There is a fetal hemoglobin and there's an adult hemoglobin. So when the baby, or rather the fetus, is still in utero, that's before the delivery, there is the baby has what we call fetal hemoglobin. And this fetal hemoglobin does not have the tendency of producing the sickling type of red cells. So this fetal hemoglobin now, immediately after delivery of the baby still have a lot of high percentage of the fetal hemoglobin in them. So within the first 6 months of life, you will not see any symptoms. But in some literature, you will see that around the 4th month of life, some features will begin to appear. And among the earliest symptoms that you see in them is what we call hand and foot syndrome. This means that the hands are usually swollen and the legs, and it usually involves the both hands and the 2 legs too. So this is one of the earliest symptoms.
The swelling of the hands and the legs.
Yes, and the legs. So, and at times, it's really escaped the parent. And it can already come back to mind when you try to poke, like trying to get more information from them. They can now cast their mind back that, oh, when the child was around, let's say 4 or 5 months, yes, I noticed that.
Okay.
That the legs were swollen then, and the legs were swollen too. So medically, we call it foot and hand syndrome.
But at that stage, the child may not be sick.
It might not be sick, yes.
Okay.
The child might not be sick.
But most of our infants die, as in based on the statistics, like 85% in Nigeria will still die. So what is the cause of their death if the symptoms does not show very early until after 6 months?
Yes. Well, before I go into that, I also want to dwell more on other symptoms, because that foot and hand syndrome is not actually the only symptom of sickle cell disease. Another thing they could also present with is what we call jaundice, yellowness of the eyes, is one symptom to be present with, and they could also present with features of anemia. Anemia means that in a layman way, when there is no enough circulating blood within the body. So they will tend to be breathless, tachypneic, and some other things like that. So those are some of the symptoms of, and occasionally they can also present with crisis, what we call sickle cell crisis. Yes, they present with crisis too. Is another way they actually present. And the reason why most of them died, you understand, just the way you asked, is because most of the time the diagnoses are not confirmed, so an adequate treatment are not usually instituted at the
early stage.
Yes, at the appropriate stage. But once the diagnosis has been ascertained, and they could continue their regular medical checkup.
So are you saying that the mother should check if the child is having the sickle cell disease once the child has been born, so that they can start giving the child treatment?
Yeah, no,
Or
yes.
what?
Rather, in just like I said, in developing nation, where we happen to be part, is not really easy, because if like in the Western world now, is a kind of routine. Do you understand? That's what they call routine checkup. Immediately a child is being born, you understand? They do some tests, quick tests, to know the genotype of this particular baby. So that can give you a pointer that this child is a sickle cell patient, and you could actually institute your management at the very beginning, from the very start. But in where we stay here, most of the time they come to the hospital, usually not at the initial stage. They come to the hospital because of one symptom or the other, or even in crisis. So you can see it's not really a kind of an easy thing here compared to what is being practiced in developed nations.
What are the diagnoses for sickle cell disease?
Yes, the diagnosis of sickle cell, usually it starts from the symptoms and the sign. The symptoms are actually what the patient complained of, and the signs are what the doctor is able to observe from the patient. So just like the symptoms I earlier mentioned, of jaundice, failure to thrive, features of anemia, all those stuff will give you a sign that, hey, maybe I'm dealing with a sickle.
Yes.
Then the genotype of the parent too, like
Will also tell?
it will also give you a pointer. Like in my center here, in the Department of Obstetrics and Gynecology, what they do, there's what they call booking. They come to register their antenatal. So among the first, that's the initial visit. Some of the investigations they've been requested there, even genotype is one of them. So that's, you have that at the back of your mind. But for you to ultimately diagnose sickle cell disease, you need to do what they call hemoglobin genotype. That's going to tell you if the child is SS or AS, which is the carrier type.
So what are the treatments? Let's look at the treatment for sickle cell disease.
Okay. When you are trying to treat, there are some things you have at the back of your mind. First of all, you try to alleviate symptoms. What this means is you check how the patient presents. Just as I said earlier, most of them present in crisis, what we call sickle cell crisis. And it's good to know that the crisis, there are 4 types.
Okay.
Yes, there's what we call vaso-occlusive crisis. Another type is sequestration crisis. Another type again is hyperhemolytic crisis, and finally aplastic crisis. I know this will appear strange, but what it means is like in vaso-occlusive crisis, the blood vessels, like generally in the body, there's artery, veins, capillaries, carry blood around the body. So there are what we call micro circulation. That is the micro circulation. That's the smaller blood vessels that carry blood around the body. You understand? So because these sickle cells, as I said earlier, they are of sickle in nature. That's the crescent shape. Because I say they are in that shape, as opposed to the normal one that are of normal biconcave disc. These sickle cells now will now go and obstruct those smaller microvasculature. And by doing that, they impaired the blood flow to those organs. You understand that those tiny blood vessels supplies.
So what now happens?
Good. So with the blockage of those blood vessels now, the blood is not reaching those organs that they are being supplied. And as a result of that, they will present with severe pains.
Okay.
Yes, that's one of the symptoms. Pains.
Very painful.
Very painful. It could actually vary from mild to severe form. So depending on the type of the pain that person presents with, that will now determine the nature of treatment we are going to use. But for the mild pains, for instance, you can actually manage them by giving mild analgesic. But for the severe ones, occasionally we used to admit them and give them the appropriate medication. Then another very important component of management of sicklers is fluid therapy. Because one of the predisposing factors, that's things that can predispose an individual to crisis, it's dehydration. That's when there is no enough that water in the body that could actually tilt a sickler into crisis. So you need to give them IV fluid. You need to fix line and give them IV fluid. Then among the things that can also predispose them to crisis is infection too. So we need to treat infection with appropriate antibiotics. Then even malaria, as I earlier said, tends to weaken, they are more prone to malaria as opposed to the, what they call it, the trait, the carriers. They don't easily, they are more resistant to malaria attack than the sicklers. So as a result of that, we give them malaria prophylaxis, that's using Panadol and also folic acid to optimize their hemoglobin level.
What is your advice to those who are infected? Because we've discovered that this disease is common and most parents are having it, their children are infected. What advice do you have for the victims?
My advice basically, I think it goes from even from the premarital status. Before couples should engage in, I can't say relationship now, but before marriage, it's better they know their genotype. And it's not usually advisable that somebody that is a sickler, that's SS now, to marry another AS, or even AA to marry EA, because they stand the chances of giving back to sicklers. So
AA to marry?
AS to marry AS.
Okay.
It's not advisable. It's better when AA, if you are AE, you actually have the chance of marrying either AS or SS. So since you don't have that abnormal gene, it's very, very unlikely for you to give back to sicklers, or rather, you could get carriers. So the advice here is good, is that couples, or rather, before really marriage, should go for what do they call it? Genotype testing. It's good they know their genotype status before they go into marriage. And for those that are already living with the disease, it's better they come to the hospital for a regular medical checkup so that they will know their stable hemoglobin and also take their prophylaxis medication, as I said earlier, the Panadol and folic acid. And there's also another aspect of treatment that I don't want to go in here. It's all about, they said for now, sickle cell has no cure, but the ultimate management is bone marrow transplant, although it's not free of its own complications. And again, drugs like hydroxyurea are also very important, but it's not popularly used here. So I think in general, it's good for couples to have genotype testing for marriage. If you have a children or yourself, you are living with sickle cell, it's better you come to the hospital regularly for follow-up so that it will prevent you from going into crisis.
Thank you very much, Dr. Ahmed Abdusalam, for your time. Thank you for educating us on sickle cell disease. It's nice having you.
Thank you very much.
The people with sickle cell disease are like every other member of the society. They have their dreams and aspirations. They want to succeed. They want to live a healthy life. The medical personnel are working so hard to reduce the death of infants with sickle cell disease, or better still, eradicate it. Till the same time on Medi Show, we're wishing you a wonderful time. Bye for now.